Hi, welcome to the Progeny Imaging Software tutorial. My name is Danielle Heberly, and I am the Dental Clinical Manager for Midmark Animal Health. Today, we're going to go through Progeny Imaging Software from the very basics of entering patient and client information to exporting images and printing client handouts upon discharge. So we're looking at our main screen right here. The very first thing that you should do is make sure that you are operating on the most current version of Progeny Imaging software. To find out if you need an upgrade or if you're currently working from the most upgraded software, if you come up here to the Help button, select Help, and check for updates. What this is going to do is bring up a window down at the bottom of your screen, and it will let you know if you're either up to date or if there is an upgraded version of the software available. If there is an upgraded version of the software available, it will provide you a link to our technical services department where they can remotely upgrade your Progeny imaging software for you. So once you've determined if you're working on the most current version of the software, we're ready now to start the remainder of the tutorial. The very first thing you're going to do prior to starting acquiring images is you want to make sure that your device is connected. And how we know if the device is connected is by looking up here in this little window and looking for that green ball. When you see that green ball, that's an indicator that we've detected your device and that you're ready to acquire images. If that device is red, that means something is not connected properly into either the computer or the X-ray generator. So before we get nervous and call tech support, we want you to check a few things first. A lot of times when you open up the software and click that drop-down button, perhaps the none is selected. If that none is selected, that means no device is selected and you will get a red ball. So if you want to select the device, you hit that drop-down box and you can either select the VetPro CR or the VetPro DR to begin acquiring your images. Today I'm working off of the VetPro DR, so I'm going to go ahead and select that device, and you'll notice because my device is plugged in, it will turn green. So if the VetPro DR or CR is selected and that's the device you're using and you're still getting a red ball, you want to make sure you check your USB ports. Make sure that that USB port is connected, that your cord is firmly connected into that USB port. If that looks good, then you want to check your connection on the X-ray generator as well. And if you are using our VetPro DR through our generator, you want to make sure that the generator is turned on. And if you've checked all those things and you're still getting the red light, then it's time to call 1-800-MIDMARK and follow the prompts to imaging technical support. So from there, I want to go over the four main areas of our software. If we're looking at this screen, everything that you need to do is done off of this one main screen right here. In the upper left, we have our tooth template. So it has, if we're in a feline patient, it will have a feline tooth panel up there. If you're in a canine, it will have the canine panel. So we have that here. This is where we select and really customize which teeth, how many teeth, and in what order we're going to acquire those images. Down here on the bottom left, this is our image database. So when we're in a patient folder, however many images that we've acquired on that patient, they will all be right here in little thumbnails in the imaging database. And once we open up a patient, you'll see those images load, and we can go over a couple of features of that database as well. Over to the right, we have our work surface. This is where, after you acquire the images will come up for you to view. You can view them here, you can put them up side by side, you can enhance the images here, and all of these things you can do on the work surface. Then down the very center of the software screen, you'll see our enhancing toolbar. So this toolbar has all the different options and enhancing tools to allow you to make a better diagnosis of your image, to make sure that you got everything in there that you need, it looks the way it looks, and you're ready to either reacquire that same image or move on to your next image. So now that we know the different parts of the software screen, let's start with new patient and client entry. If we're entering a patient that we've never seen before, if we go over from the green ball to the left, there's a little folder here with a sun on it. If we select that, this will pull up our patient property screen. Progeny imaging just requires 4 things in order to open up a folder and start acquiring images. And they're asterisked here. So we've got the patient's first name, the owner's last name, the patient's birthday, and then the species of the patient down here. Once you've entered all of that information, you can go right into the patient file and start acquiring images. If you'd like to add additional information to the patient property screen, you're welcome to do that. If you want to enter the client's name, perhaps a phone number for contact, maybe an email address, that's all optional and up to you. If you enter those 4 things, though, you can get right into that file and start acquiring images. Once you're done entering that information, you just click OK, and that will bring you directly into the patient file. Now, let's say we are acquiring new images on a patient that maybe we've seen last year and acquired images on. So if we want to just add images to an existing patient's file, we're going to go over from the new folder patient, and we're going to click on the Open Patient tab. So this is going to pull up a list of all the patients you've acquired images on, and it will default in alphabetical order by the last name. We want to make the screen bigger. We can enlarge it here. So you'll notice that these are all listed in alphabetical order by the patient's last name. But if we want to switch tabs and have it in a specific order from maybe the first name or perhaps the last time we acquired an image, we can do that too by just clicking on the individual tabs up at the top here. And then you'll notice we can search by different parameters. You also have the ability down below to just start entering the patient's last name. And once you do that, it will automatically reduce that patient, and you can double click on it, and now that will take you into the patient file. So you notice now that we're in here, all of our images just loaded down in the database, and they load from the most recent picture to the oldest picture that we've acquired. So we have a slide bar down the side of the image database here, and we have a slide bar down at the bottom of the database, which will increase and decrease the size of our images. I'm going to go up here and open up another patient. So if I want to open up an existing patient, I can hit that Open tab. It'll pull up my list of patients that I've acquired images on. I'm going to double click on the patient that I want to open and add new images to, and that's now going to bring us into that patient file. You'll notice at the very top of the image database, it has a Folders tab and the number 16 in it. That means that you've acquired 16 images on this particular patient. We also have a tab to the right that's a Studies tab. So we can create little subfolders of particular images maybe that we want to look at first the next time this patient comes in and compare with the new images. So that is a folder that we can store specific images in to go back and review easier than scrolling down through all 16 of the images. I also want to point out when we get into a patient file, when the tooth panel comes up, you'll notice that the Triadin numbers appear above and below the teeth. So we're in a canine patient right now. If you're not familiar with the Triadin numbering system, it is a tooth identification system. We have it for our teeth, and all the different species have it as well. Don't worry if you're not 100% familiar with this numbering system right now. As you start to work with the software, you're going to become more and more comfortable with it. The one thing I do want to point out is you do want to make sure that you know what the left and the right side of the patient is. So if we're looking at this tooth template right now, it's as if we were looking straight onto a patient. So this would actually be the patient's left side, and this would be the patient's right side. So just keep that in mind, and then as you get more comfortable with the software, the tooth numbers will just make a lot more sense to you. So don't worry if you don't know them right now, you will learn. So if I want to reduce the size of this tooth template, I'm going to double click on that gray bar here, and how I increased it was this little up arrow right here. Okay, so the first thing that I want to go over is how to acquire images. There's several different ways that we can acquire images within the software, and we do this because not every clinic acquires the same amount of images every time. Not every clinic has the same protocol for acquiring their images. So we offer a few different options for you, and hopefully one of the options will suit your practice needs. I'm going to increase the size of this here. So one way we can acquire images is to work directly off of the tooth template here. Working off of the tooth template allows you to customize which images you're going to take, in which order you're going to take them, and how many images that you want to take on this particular patient. Why I like to work off of this screen is because not every patient is the same size. So if I'm working on a feline patient, if I'm doing a full mouth on a feline patient, I may only take 8 to 10 views to get a full mouth set of x-rays. If I'm working on a large canine patient, let's say a pit bull or a Labrador, I may need to take 26 to 28 views to get a full mouth set of x-rays. So once you get really comfortable taking x-rays, you're going to know when you see a patient how many views it's going to take you to get a full mouth set of x-rays. There are some clinics that aren't going to take full mouth set of x-rays on every patient. Maybe that patient was in 6 months ago and got a full mouth set of x-rays, and this time we're just going to go back and take more images of a particular area of the mouth. This screen here allows you to really customize which teeth we can take without needing to take a full mouth on every patient every time. So let me show you how this works. You'll notice as I run my arrow over these teeth that they light up. So let's pretend that we are going to take the upper incisors on a small patient. So I put my arrow on one of the outer incisors. I'm going to hold my left click, and I'm dragging my arrow over all 6 of those incisors. Now, one suggestion that I have is when you're using this software, I really like to use a wireless mouse. The wireless mouse keeps my hands off the keyboard, so if I'm the only one doing the procedures, which in a lot of cases, four-handed dentistry isn't always possible, but it is recommended. But if I'm doing the x-rays and doing the procedure at the same time, if I have bloody gloves on and I'm working on the keyboard, I'm getting all of that onto the keyboard. So the wireless mouse helps keep all that gunk off of your computer keyboard. So if you can get one of those, I highly recommend it for that and just the ease of use. It's a lot easier to work with the wireless mouse than your hands on the keyboard itself. So now that I've highlighted all 6 of those incisors, you'll notice that they light up with the number 1. That means that that's our first image. If this is the only image we need to take on this particular patient, we can just come right down here and select the radiation symbol. We don't want to select the one with the lightning bolt. I'll go over that in just a minute or two, but we're going to select this one. Now we need to wait until those teeth flash before we acquire the image. So once the teeth are flashing, we can position the sensor and the software and the tube head and acquire our image. So that's if we just want to take one at a time. Just going to hit stop here. Okay, now let's say on this particular patient there's multiple areas of the mouth that we want to take. What we can do is come up here and say, okay, maybe we did some probing here and we found a furcation exposure on this 208. I'm going to click that 208. We want to definitely get a picture of that tooth. Maybe over here on the right side, we're missing that 106, and we want to make sure that it's really missing, or maybe there was some kind of injury or a retained root that was left behind. So I'm going to click that. That's going to light up with our number 3. Maybe we want to get back here and take all 3 of these last teeth here, the upper 4th premolar and molar 1, molar 2. I'm holding my left click and I'm dragging over those 3 teeth. So now I've just lined myself up 4 views. When I hit that radiation symbol, those ones are going to start flashing. Now once we acquire that image, it's going to come up over here on the work surface, and automatically the number 2 is going to start flashing. So it's going to move you right through that series of 4 views without you having to go back to the computer, which makes it really nice and efficient for you. One thing that tends to happen, especially for the beginners, is that you may miss an apex of a tooth root, or you may need to get another view of a particular tooth that you acquired an image of. If you need to reacquire an image for the purpose of missing a certain part of anatomy on that view, what we want you to do is hit the stop button. It's going to ask you, do you want to cancel the acquisition? You're going to say yes. So once we cancel the acquisition, the screen is going to blink a little bit, and now everything will go solid. If we want to reacquire an image, we're going to go up to that image that needs to be reacquired. Any one of the teeth in that one sequence that we've highlighted, we can right-click on it, and we're going to select Reacquire. Now, because I don't have an image on the screen, that Reacquire isn't lit up. But once your image is on the screen, and you need to retake it, you right-click on that particular tooth you need to reacquire and select Reacquire. Now, what's going to happen here is those teeth are going to start flashing again, and you can go ahead and take your image. You don't have to hit the radiation symbol. Once you hit Reacquire, it's automatically going to arm the device. Now you can reacquire that image, and the number 2 will start flashing. So you can move on through the remainder of your series. So that is for when you need to take a view over that you don't like. Perhaps it wasn't diagnostic, you missed the apices of the tooth roots, because when that new image comes up, it's automatically going to delete the one before it. So that's why that's only used for a reacquire purpose if you want to get rid of the image that you just took and replace it with your new one. Now, if you take that image and you like it, but you kind of want to get a different view, what you need to do is proceed through all 4 of your series and go back and take that one over when you're done with the series. In one of the future upgrades, we're going to give you the option to either reacquire or get an additional view without having to proceed through the rest of the sequence. But for now, we're going to do right-click Reacquire to replace an image, and we're going to go through our sequence and go back and take another view if we just want an additional view. Okay, so this is if we're really customizing for the patient. And you can also acquire full mouth series from here as well. I'm holding my left click. Maybe this is the order that I want to acquire my images in. So I can line up as many views as I want on this particular patient. And I know that when you get comfortable acquiring images on all of your patients, you're going to know exactly how many views it will take to get a full mouth. Okay, the second way you can acquire images is through a template. So templates are customizable, and they're really for full mouth radiography. So if your plan is to do a full set of x-rays on every patient that goes under anesthesia, which is what the AHA guidelines recommend. You can create a template, and so for every patient you open up, you're going to be taking the same amount of images in the same order for every single patient that you work with. So because patients are different size and they all take different amounts of images to get a full mouth set of x-rays, we give you the ability to customize your sequence. Another reason we do that is because not everybody takes their x-rays with the patient in the same position. So we see a lot of clinics doing the maxilla and sternal recumbency and the mandible and dorsal recumbency. We've seen clinics do all of the radiographs with the patient in dorsal recumbency, and we've seen clinics take all of the x-rays with the patient in lateral recumbency. So what we wanted to do was give you the ability to customize your templates based on however you like to acquire your image. So if you want to create a new template, what you're going to do is just pretend that we're working off a regular customized tooth template right here. So I will highlight the teeth in the order I like to acquire them in. So I'm going to go through, we'll say I'm working on a medium-sized patient. I'm going to highlight all 6. Okay, so now I've got 14 views here. This is for like a small to medium-sized patient. I've got all of them highlighted in the order I want to acquire them in. Now I'm going to right-click and I'm going to select Save as a Template. Now it's going to ask me for the template name. So I'm going to type in small, medium, patient. Actually, I'm going to do small, medium, full mouth series. And I'm going to hit OK. So now when I'm ready, and all I have to do is create that one time. And so for the next time I open up a different patient's folder, I can come in here to the template area, which is right here. I always look for the 4 squares, hit that drop-down box, and now I can select from whichever template that I want to use. And once you highlight and click Save as a Template, it's going to give you a window where you can arrange all these boxes in the order that you want to see these images when they come up. And how you acquire them is just hit that radiation button, and now the number 1 is going to start flashing, and you proceed through acquiring the images just like we did when we were highlighting individual images from the tooth panel. And if we need to reacquire, it's the same way. We just hit Stop, cancel the acquisition, and then the right-click Reacquire. So that's the second way to acquire images. The third way is called Rapid Fire. So this option right here with the lightning bolt or quick start gives you the ability to just start taking your images without highlighting the teeth. So this is a really good option if you have an anesthetic risky patient that you're working with and you really just need to get in there, acquire these images, see if any treatment is necessary, do that treatment, and then get the patient woken up. So it's good for that. It's also good for extremities on small animals and exotics too. So the one thing to keep in mind about working from Quickfire is when you use this feature, you're not going to get the tooth number on the image. So let me pull up one of our images here. This is a incisor view here, but you'll notice at the top left of the image, we're going to get the tooth numbers on here. So when you work off a Quickfire, you'll get a blank image. So if we want to go back in and make sure those images are labeled. So this one is labeled already, but if we want to add in teeth to that image, we're just going to hit this little tooth icon on the top right, and we will select additional teeth or remove teeth or whatever we need to do to get that image labeled correctly. This is the one really neat feature with our software, especially for beginners, and you're just learning that tried and numbering system, and when you look at these images, initially when you're just looking at the image itself, you may not know if you're looking at the left or right side of the patient. And that's really common. You know, the boarded dentist can look at that image and they know exactly what they're looking at. They know they're looking at the upper right canine, and you may not know that as you start getting into dental x-ray. So what's nice about having the tooth numbers here is you can say, okay, that's 104, 105, 106. You can come over here and say, oh, I know that's the left side. And you can look and correlate those tooth numbers with the teeth here because that's what you highlighted. So that's one of my favorite features of the software right there, because it really kind of takes that guesswork out for me regarding what side of the mouth I'm looking at. So if we needed, we'll go over this once again, if we needed to add or remove a tooth number, we can do that by hitting that little tooth icon and then adding or taking off tooth numbers. And now you'll notice it just goes to 104. One little clinical tip that I have for you is when you're acquiring the canine teeth on the maxilla, and this goes for canine or feline, I really like to just focus on that canine tooth by itself. We'll definitely get in other teeth depending on the size of the patient. You know, here we have that outer incisor, and we've got our first, second premolar in here. But all of those teeth, other than the canine tooth, are a little distorted. Sometimes they won't be distorted, but chances are they're going to be a little distorted. And because you're using digital, whether CR or DR, it doesn't take long to get those other teeth separately. So we want you to be able to get that canine tooth all by itself so that you can see all the necessary structures around that tooth in order for you to make a diagnosis. This can be a tooth that is problematic sometimes, so that's why it's definitely worthy of having its own image. We don't necessarily have to do that on the lower canine teeth because depending on the size of the patient, you may be able to get both canines and all 6 incisors in between in the view without any distortion. The larger the patient gets, though, you will not be able to get both of those canine teeth in the same view. I also want to take the opportunity, I'm double-clicking that image, which is going to bring it up full size for me, but I want to take the opportunity for those beginners doing dental x-ray to know what you're looking for when you're taking dental x-rays. We want to make sure as technicians that we have everything in that image necessary for the veterinarian to diagnose that image. So a couple of things we want to be able to see. Most important here is the apex of the tooth root. So the very tip of that tooth root, we want to be able to see that apex, and we want to see at least 3 millimeters of bone around the apice of that tooth root. This is where abscesses tend to occur on this particular tooth. Not tend to occur, this is where they do occur on this particular tooth. And so we need to make sure that we can see all the way around that so that we know it's a healthy tooth and we can go on with the remainder of our x-ray. So we want to look at the apex of that tooth root. We also want to be able to see the periodontal ligament, and that's this line that goes all the way around here, that black line that goes all the way around. Depending on the age of the patient, it's going to be either really prominent or it may not be as prominent. A lot of times as the patient gets older, changes occur, bone changes, the ligament changes, and things will look a little bit different. So we want to make sure that we can see that whole ligament around the tooth. The other thing we want to look for is the root canal and the pulp chamber, which is this little clear line that goes all the way down through. Now, in this particular patient, it's very thin, But you may notice on some of your patients that that is very wide. So a couple reasons for that. The older the patient gets, the smaller, the more narrow that pulp chamber and root canal will look. If we're working on a young patient, that's going to be a lot wider. Now, the exception to that is if you're working on an older patient and you're seeing a wider pulp chamber, then we know we have a problem. So that's an indication there of pathology. So you want to be very mindful of what these different structures look like and make sure that you're documenting those things. If you're ever concerned whether something is pathology or it's normal, take the other tooth on the other side, whether it be the left or the right side, and compare those two teeth. If one looks very different than the other, chances are that could be pathology, but sometimes they look exactly the same, and that will help you gauge whether you may be looking at a pathological issue or not. The other thing we want to see is this alveolar bone. This is the bone around the root of the tooth. This is where bone loss occurs. So when we get periodontal disease in more advanced stages, we're going to lose a lot of bone, and we need to be able to see that. So we definitely want to be able to see the bone in between and around the teeth if we can. So those are the main things we want to see in the image. The crowns of the teeth here aren't 100% necessary because we can just lift up the lip and look at the crowns of the teeth. But if we have a tooth that has a fracture, or if it's discolored, or if the enamel looks funny, then we definitely want to be able to get from the tip of the crown to the apex of the tooth root. So those are just a couple little clinical suggestions for you. I'm going to double click and this will go back down to regular size. Let me pull up another image here. Okay, so here we have another view. What I'd like to do now is go down through our enhancing tools so I can show you the different things that you can do to the image in order to better diagnose it. So we're going to go through here. A zoom in. If I click that, each time I click it, it's going to zoom in a little closer, and it gives me a slide bar where I can just kind of pan around the image and take it to where I need to get a closer look. So that was the zoom in, and I've got the zoom out, which takes it back down to regular size. We have the magnifying glass. This is a really neat tool. I'm going to click this, and I'm coming over and I'm holding my left click button down, and it gives me a magnified look of the teeth. So I really like this if I want to get a closer look at those periodontal ligaments, the furcation areas. What's that pulp chamber doing? How does that alveolar bone look in between the teeth here? All the while I'm holding my left click button while I'm doing that. Now we have an annotate and measure. So you'll notice when I click that ruler, we're going to get a little pop-up that comes down below the image that's going to give us the ability to do several different things to the image. These are going to be annotations that we can actually put on the image that will print out. We'll start first with the arrow. So I'm clicking the arrow, and now I can come over here and I can draw that wherever I want, that arrow. Let's say I want to write a text box underneath that arrow. I can hit that T. I have to draw myself a text box first, and now I can come in here and type in whatever pathology or whatever information I want to add to that image right there. I also have the ability to circle things. So I click on that circle. What I do is just go ahead and draw it, and from here I can click on it and move it all around. So I can stretch it out. I can move it. And it's a lot easier than trying to make it perfect the first time. We also have a measuring device here. Now these are more used with the advanced procedures than just your regular dental procedure. So chances are you're not going to use this tool very much, but it's available for you if you want to use it. So if I want to measure, it's going to do a measurement for me. Now, if I want to get rid of those annotations, all I need to do is make sure that I'm in that window. I click on the ruler, then I can come over here and click on whichever one I want to delete. Once it's highlighted like this, I'm going to hit delete. Now these will take the annotations away. If I leave them on, they will be printed. If you're printing, the images are going to be printed out on the handout. So this is a really nice tool, especially if we are finding some pathology on these images, to go ahead and point those out, circle them, write text on the image. So when you print these out for the client, that's really going to increase the perception of value and bring light to that area of pain in their pet's mouth. The other neat feature we have, you can access it here on the toolbar, but there's a little shortcut right under the image, and that is a text box or a post-it note. So if I click that, it's going to open up a text window, and now I can come in here and I can start typing in any kind of information that I want. Once I start typing, it's going to flag it over here in the database for me. And this is really great because if you're taking your images and then the doctor later is coming to take a look, you can maybe put some charting information in here. When the doctor comes back to review, he or she can put treatment notes or plans in there, information on rechecks, any kind of information you want to add in here. But do know that the information you add to this text window will get printed out on that client handout. So just keep that in mind. There's a rotate button. Shouldn't really need to rotate these images. If you happen to get an image that comes up upside down, that means that you've probably highlighted the wrong side of the mouth. So if you highlighted the right molars and premolar here, but you accidentally took the left, your image is going to come up upside down. So if that happens, you can do one of two things. You can either reacquire that image or you can just rotate it. It's going to save the image however you closed out the software, it's going to save it. It's also going to keep that original image too. So you can always go back to the original and you can always keep and review the filters that you've applied as well. So as we're talking about filters, we can go down through here. Our next little tools have the contrast adjustment to them. So there's 3 different options here for that. The half and half here provides a slide bar for brightness, contrast, and intensity, where you can come through here, you're holding your left click and just kind of sliding those different levers over to enhance your image. This is what I prefer to use over the one we just went over. This is a gamma. When I select this, it's just going to tweak it a little bit, darkens it up just a tad. I hit OK. Most of the time, if you're using our generator and our sensor, you won't need to do a lot of adjusting with the contrast. But if you do, you may want to darken up the images because everybody likes to see their images a little bit differently. We have a lot of veterinarians that want to see a more grayscale image, and we have a lot of veterinarians that like a more black and white image. So these filters will really allow you to get that image to how you like to view them because everybody's different. So I just find, like I said, if I click that one time, it just tweaks it just enough to get it to right where I want it. This is one of my favorites. This is the invert button. If I select this, this is going to give me a negative of my image, and you'll see with this image how much it makes those periodontal ligaments in the pulp chamber stand out. So this is great. If we have a pet and you don't know if it's fractured a tooth with pulp involvement, maybe there's an abscess there, you're not sure, you're looking at a fracture, this tool is really going to help you with the detail you need to see in order to make a diagnosis. So this is one of my favorite features of the software. Another really neat one down here is the Sharpening Tool. So this is like the little upside down triangle. When I select that, it takes it from that grayscale image to more of a black and white. So I'm going to come up here and hit this undo button. I just want to show you the difference really fast. It's very minute, but you'll see the difference. So if I go back, there's the more grayscale. If I put that filter on, it just kind of tightens it up a little bit, so it tightens that image up and gives it a little more pop so that you can really identify that periodontal ligament and the other structures that we talked about before as well. This is a really great one here. This is an embossing tool. It kind of reminds me of a fossil when I select it. This is great. Again, we see a lot of the boarded dentists using this tool when they're doing advanced procedures, but I really like it if I'm having a hard time visualizing my periodontal ligaments, maybe not on this particular image, but let me see if I have a 3-rooted tooth. Here's one. Let's see here. See if I can find another one. But when you're working with, let's say, a brachiocephalic or a feline patient with a prominent zygomatic arch, this tool, if you hit emboss, you'll see how it really allows you to define those roots a little bit better. So if I'm having a hard time and I've got a lot of bone perhaps sitting over my tooth roots, I really like to use that embossing tool to help me visualize all 3 of those roots and their periodontal ligaments and pulp chambers. And those are the most popular enhancing tools that you're going to be using on a regular basis. Now you'll notice down here on the bottom right, there's like a little daisy down there. When you see that little flower at the bottom right of your image, that means you've applied filters and you've enhanced the image. And as I said just a few minutes ago, because these are Dicom images, the software is always going to save that original image. But because you don't have to save each individual filter that you apply, you have the ability to take them off and put them back on as well. So how I did that before was I went up to this undo button, and now if I just keep clicking it, it's going to take me through all the filters that I did. It's going to undo them all. So this was our original image. And if I hit the redo button, now it's going to take me back to where it was last. And if I put it back down in the database and open it back up, it's still going to have all those filters. It's going to remember how we left it last. If you want to remove all of the image filters permanently for this visit, you just click that little daisy. It's going to ask you, do you want to undo all image filters? You're going to hit yes, and now it takes you back to that original. And now it's removed all those filters that you applied. So next, let's talk about how we can remove images off the screen and get images back on the screen for review. So we've got a few images on the screen right now that are stacked on top of each other. If I want to move those images apart and view these images side by side, we can do one of a couple of different things. If we right-click on the work surface, so this is the work surface. We don't want to right-click on the actual image, but if we right-click on the work surface, it's going to give us an option to tile. So right-click tile is going to put the images up side by side for you to view. You also have the ability at the very top of the enhancing toolbar, these 2 little arrows, that gets rid of the tooth panel and gives you a bigger viewing area to review your images. Hit tile here. And you also have the ability to drag down the corner, or as you've seen me do through this tutorial, double click, and that will make it go full screen. Now, if I want to get that tooth panel back, I'm going to go back up to those two arrows and click those. And now I'm back to my main screen with the images on the work surface like I had them before. So let's say I want to remove these images off the screen and maybe put more up, or maybe I'm done acquiring images on this particular patient for the day. So if you're done acquiring the images for the patient on this particular day, we do want you to remove the images from the work surface and put them back down into the patient database. The only thing that happens if you don't is sometimes when you open up the software, you might get a none here and you might get a red ball and you have to go in and select your device. It's just an extra step. Just by putting those back down into the database, it'll eliminate a troubleshooting moment for you the next time you open the software. So if we want to remove all these images from the work surface, there's a couple of different ways we can do that. First way is just by hitting the X on the upper right-hand corner of the image. That's going to put it right back down into the database. It does not delete them. If I want to do multiples back down into the database, I'm going to right-click anywhere on the work surface, not on an image, and we're going to select Remove All. Now all of our images are back down in the database right here. So if I need to delete an image, I'm going to pull this over, I can come right down here to the bottom of the database and select Delete. And it's going to ask you, are you sure? So if you hit yes, it's gone forever. So it's nice that it kind of asks you, are you sure you want to do this? If you hit yes, it's gone. If you hit no, you can just go ahead and put it back down into the database. Let's talk about how we can get images over onto the work surface. There's a couple of different ways to do that. We can either double click, and that will bring one over. We can left click drag, that will bring one over. Or if we want multiples, we can hold our left click, drag the arrow over however many we want. While I'm holding my left click, I'm dragging it over to the work surface. And now they're all going to load up side by side. And now I can right click tile. And now I have the 4 images side by side. So instead of right click remove all, I can just hit the X if I just want to remove these two. I want to view these side by side. We're right clicking and tiling, and now I can see those. So now I'm going to remove them all, right click, remove all. They go back down into the database. Since we're looking down here at the bottom of the database, I should have brought this up earlier. A couple things I want you to take note of down here. One of the nice features on this software, now this guy's only got 16 images in his patient folder so far, but if you guys have a good dentistry program in your practice and you are able to get your more disease-prone patients to come in on a yearly basis for a dental procedure, you're going to rack up quite a few images in this folder. So what's really nice about the history button is you can come in here and let's say you want to look at all the O1s that you've taken. So now if I hit an O1, it's just going to take that database and shrink it to any image that has an O1 in it. And now it looks like I've got 4 that I can choose from. And now I'm going to drag them over to the database. I can either left click, drag, I can either double click, or I can hold my left click, highlight, and drag to the right. Now I can right click tile, and now I'm looking at those 4 images. So that history button is really a time saver for you, especially if you want to just go back and take a look at those teeth that tend to have a lot of pathology or areas of concern that you have discovered in a previous survey that you've acquired. So that's what the history button does. We also have a date button. So if you hit the drop-down window here, it gives you all the dates that you have acquired images on this particular patient. So if the doctor comes in and says, hey, pull up the images from June that we took on this particular patient. You can just come right in here where the calendar is, hit that drop-down button, select that date, and now the software is only going to pull up those images from that particular day that you acquired. The other option we have here is the Publish button. So Publish has a lot to do, or has everything to do, with a Dicom server. So you've heard me mention earlier in the presentation that these are Dicom images. If you want your images to go into your full body PAC server, may or may not be accessed by practice management software. There are a lot of variables with that. So I'm not going to get into all the different ways that we can make that happen, but just know if integration is something that you're interested in, please give either your territory manager or 1-800-Midmark and follow the prompts to imaging technical support. Call us, and we will let you know how our system can work best with your system, whether it's a full body PAC server or your practice management software. So there's ways we can work with all of them. They're all different from one another, and so you just give us that information and we'll let you know what we can do to make your workflow a little smoother for you. Okay, the last thing I want to go over is importing and exporting. The digital images are really nice to have, but a unique feature that we have is giving you the ability to import your camera pictures into the digital imaging database. We have a lot of clinics that are taking the pre and post digital camera films from pre and post cleanings. It's always good to get images if there is something abnormal outside of the mouth, maybe a tumor or excess proliferative tissue, that sort of thing. You definitely want to take pictures of those things. So the neat thing about the software is that you can import those into their database here along with the digital images. So I do not have any real camera pictures on this computer, but how you would make that happen is very easy. You would either acquire the images on your cell phone, or maybe you have a nice Nikon camera in the practice. Either way, you need to plug that device in or put that chip into your computer. And once you've done that, you're going to go up to the top toolbar and select Image, and then you're going to select Import. From here, now you want to find your device, whether it's the camera, the phone, maybe you've already imported these images into a folder on your desktop or in your computer. Just access that folder and hit Open, and all of those images will populate into the patient database. The nice thing about that is that you can then bring them over onto the work surface and we can print them out. So if you want to print the images anywhere on the work surface here, we're going to select right-click tile because they're all going to be stacked, and then we're going to hit right-click print. And here's what the printout is going to look like. So we can do 1 image per page, we can do 2 images per page, and we can do 3 images or 4 images per page. I personally like the 4 images per page. I think that looks really nice. It fits really well. The images are nice and big enough for the clients to see. I like the 4 images, but if you want to change that, I'll show you how we can do that. We're going to go into Tools, and then Options, and we go into Printing. And now we can select either the 1, the 2, or the 4. When you've made your selection, just make sure you hit Apply and OK. The other thing that we can utilize the tools for with printing, we go back in, Tools, Options, is this Clinic Information tab I really like. Here you can type in the name of your practice, and you can also upload your clinic logo right here. And you only have to do this 1 time. So if you do this initially when you get the software, every printout that you print will automatically have your clinic name and your logo printed on the top of it. So I do encourage you to do that once. It just makes it look a little bit cleaner. So you hit Apply and OK. And now you'll see I right-click Tile, right-click Print All. pull up that document one more time, and then you'll notice up here is your hospital logo, the patient's name, the date the images were acquired, and then your animal hospital up here. Now, it did give you the ability to put an address there and a phone number, so feel free when you are going in there and adding that information to that area. I'll show you the apply. Okay. Now right click, print. It didn't populate the address up here, so it's just the hospital name. I apologize for that. We'll look into that. So that's how you print the images. The last thing we're going to go over is how to export the images. If you are referring your patient to a boarded dentist for a procedure after you've acquired the images, or if you want to email images to the client so that they can see the area of pathology that you need to treat, there's a couple of different ways to do that. So let's go over first if you were just emailing to a client. When you email to a client, you want to be able to send them a JPEG image. Those are smaller files. They can pull those up right on their email and view them easily. So if we want to export JPEGs, let me just remove these from the screen so I can show you the whole entire process here. So let's say we want to send them all of these from June 18th. I'm holding my left click, dragging my images, right click, tile. Now I have all my images here. So once I have the images on my screen that I want to send to my client, I'm going to come up here to work surface and I'm going to select export all. Now, from here, I can either create a folder on my work surface, my desktop, my documents, my C drive, depending on your operating system, it'll give you different options of where you can actually save that folder. So I'm going to do Windows. I create a new folder, and now I can name that the patient's name. And I hit OK. And so now I can go into my email and attach a file, just like I would attach anything else to an email that I do. So that's how to do JPEGs. Another way is to export them as Daikons. And the reason why you would want to do that is if you were referring this patient to a board-certified veterinary dentist, they would probably want to view these in Dicom format so that they can import them into whatever software they're using, and they can use the enhancing tools that they're comfortable with to enhance and tweak the images in order for them to help diagnose that particular view. So for that, what I'm going to do is go up to Patient, and then I go Export Patient Images. So now it's going to pull up a little Daikon viewer, and I can either select all, and it will export all of the Daikon images, or I can go down and do the Control click and just select several images of concern that I want to send. So once I do that, I hit the export button, and again, it's going to ask me where I want to do this. And I'll say the desktop, and I select OK. So when you're looking for these images on your desktop from your email or outside of your email, you're going to go into a folder called Progeny Imaging Export. So let me take you to my desktop. And now I'm going to look for the folder called Progeny Imaging Export. Maybe I'll search for it. Got a lot on my desktop here. Okay, desktop. Progeny imaging export. Great. So I just double click on that, and that's what my folder is going to look like. And I'm not going to see the thumbnails here, but it's just going to have the images with the DCM behind it. So I just click the ones that I want, and I hit open, and now those are going to attach to my email, and I can send them that way. So those are the different ways that you can export images. The last thing, sorry, I lied. We've got one more thing that I want to go over, and that is how to back up and restore. Depending on how often you're using the software, it is really important for you to back up your images just in case something were to ever happen. I do recommend an external hard drive. A lot of people or a lot of bigger clinics that are using a large picture archiving communication system or PAC system like to push these images over in there, and then they can store these on a cloud or store these all together, all their digital modalities together. You can do that as well. Either way, so you're going to go up to File, and you're just going to select Backup and Restore. And it's going to ask you what you want to do. I'm just going to go Next. I want to back up, Next. And now I can pick my hard drive or whatever I want to back those up on. Like I said, I really do like an external hard drive. The CD and the flash drive, it just takes up too much space, and it takes a lot of time to export those. So if you get a nice size external, that's really ideal for this. Or like I said, you can push these into your PAC server, and however you store and back up those full body images, the digital dental images could be in there as well. So that brings us really to the end of this software. If you have any other questions, feel free to reach out to either myself or call 1-800-MIDMARK and follow the prompts to Progeny or imaging technical support. We also do provide in-clinic positioning training and software training. So if that's something that you're interested in, or any of our other training programs that we offer, go visit our website at www.midmarkacademy.com. We have multiple RACE-approved courses that we are providing on a daily basis to all the clinics out there in the industry investing in dental x-ray. And this really does help not only with patient care, but it gets your staff comfortable with using the system and how to acquire the images. So please check out that website and look at our training programs. And if you do have any questions about the software, feel free to shoot me an email. My email address is D and then my last name, H-E-B as in boy, E-R-L-E @midmark.com. Thanks for watching our tutorial, and keep your eye out for some new and exciting upgrades that we have coming out this year by once again going up to the Help button and checking for updates.